and we can support
But you
that.
guys and I are you're not working in concert with the mayor's office?
No, I mean,
Yes, sir.
Dr. Eichschild and our emergency preparedness coordinator went by the Ladd Stadium location today
Okay.
to sort
But
of,
that mic's
you know,
on.
take a look
Mic
and
check.
provide some
Yes,
advice.
sir.
So
Yes, sir. Looks
I
good. Okay.
think that
Tyler's
is
gonna give us a
cooperation,
mic check
so,
real quick.
but I don't know to
Let's
what
see. Or
level.
better yet, I'll go up there
I
and
didn't
give
mean
him a mic check.
cooperation, I
Hold
knew
on.
you guys were cooperating, I'm just talking about the schedule and stuff, and they are typically here in this area for you guys as well.
Yeah, I think we're all trying to get.
All right, Al. Do you see me, sir?
Would it be your guys' team handling the testing?
Okay, I'm gonna stand up here where the speaker would be and probably be speaking about this tone. I hold the phone away from my face. How does it sound?
Oh, so you gladly would do it if they, okay.
We would support them.
Yes, sir.
If we had the staff.
Yes, sir.
Obviously EMS and fire, or EMS is the general train probably to kind of prevent the spread of things, but you guys have more training in that situation to make sure that people are, the nurses are staying safe.
Yeah, I mean, we want to protect our first responders, you know? I mean, so if we could have.
We've got one more station coming.
Oh, okay, okay.
Yeah, so just hold on for
Wic.
1 more minute. They were able to do the mass testing, so who's going to be
This is a
out
bunch
there
of stuff.
manning that then? That would be you guys?
I'm not sure what the
Plan is
mayor is planning. We have been planning for a open testing facility, have been planning it for some time now, at least 10 days. But we can't get the supplies. So we can't stand it up until we get the supplies. Did you take something?
That was a news release that Mark sent out. You're just gonna say something about it, and the
Okay.
news release is already out on our website.
Okay.
That's one less paper you gotta keep up with.
We still actually take it on TV. Well, by chance you.
What do you need?
But before we take it.
Yeah, because if they see you on TV, they may try to take you and they're just standing
Can
there.
I get my notes?
Yes, sorry. I've hand our camera off to make sure that
We want to protect you from doing one of these.
Oh, yeah, they did that to me the first time we did this on Tuesday. But that's okay. I learned. But thank you. But James, you just, so I just walk up there? Is that what you're going to do?
Well,
He's setting up.
when he gets set
I
up,
just,
then.
I just didn't want us, because our station has a streaming back at the station, so
Got
if
it,
they see it,
okay.
they'll take it, and I go.
Got it, okay.
Yeah, as soon as it gets set up, I'll cue you.
I know they're not ready. We're just waiting for Jeff to set up. It's just,
I hear Hawaii's on quarantine.
Really? Hawaii?
Isn't that
Are we
where
going
you're
there
from?
next? No, no. Cuba.
Cuba.
Cuba. I was born in Puerto Rico, but was stationed in Cuba.
Got it.
Gitmo is my brother's favorite station.
I went
Oh,
to the
yeah?
90s when I was
Better,
working
better
on
than
college.
Holy Loch, Scotland.
Yeah, I remember playing with the iguanas and good fishing. We ate a lot of langosta.
Yeah, thank you. Yeah, and don't, y'all tell me, remember not to keep chewing gum. Are we ready?
Okay, hang on.
Welcome again, our 2:30 briefing. I'm Rundy Murphy, an epidemiologist and the Director of Disease Surveillance and Environmental Services at the Mobile County Health Department. This is our 2:30 daily briefing on the coronavirus outbreak that is affecting us worldwide and in the U.S. So I just want to update you quickly on the number of cases in Alabama. So the Alabama Department of Public Health updated the numbers this morning. There are currently 81 confirmed cases in 15 counties across the state. And again, Mobile County has 1 confirmed case of coronavirus. I wanted just to address something that someone asked me about yesterday. You know, our first case was in a child, so someone who's less than 19 years old. And that was a bit of a surprise to us because we've been saying all along that children seem to have, you know, of course they can be infected, but they seem to have less severe illness and not maybe as many infections. And that was information coming out of China. The Centers for Disease Control published earlier this week an MMR article that said that the cases in the United States are looking a little bit differently than they did in China. So in the U.S., children are experiencing severe symptoms and complications, though death in children is rare. And I think among around 3,000 cases that were part of the study, only about 5% of those cases were between the ages of 0 and 19. So I just wanted to clarify that again. Things are changing all along, and as we get new information, we will update you. So still, the folks that are at greatest risk of severe complication and death are people who are older, 60, 65 or older, particularly those that are 85 and older, or anyone, you know, someone of any age who has, you know, other comorbidities, so things like diabetes or immunocompromising diseases or conditions, that sort of thing. So those vulnerable populations that we want them to, you know, really be careful about their activities and really protect themselves and their families. So about our case that we reported yesterday, as we mentioned, this is a Mobile County resident who is less than 19 years old. We've been in contact with the family, with the family's providers, have conducted an investigation to determine places that patient had been around where they might have potentially encountered close contacts, and all of those contacts have been made. The child is doing well at home. The entire family is doing well at home. I believe the child has been fever-free for 2 days, so we're really happy to hear that the child is recovering quite well. So a comment or two about the state health order that went into effect yesterday, ordering the closure of, well, not the closure, but that restaurants and bars and other eateries, they could not have food or beverages consumed on premise. That is slowly sort of being enforced. We can levy civil fines against restaurants and bars and other eateries that are violating that health order, and plan to do so if needed. Remember, everyone in Mobile County continue to patronize the bars and restaurants and you know, order curbside or order delivery, that sort of thing, because we want to keep these businesses open and viable for us as we navigate some of these new community mitigation measures that were put in place yesterday by order of the governor and the Alabama Department of Public Health. So another thing about you know, testing being quite limited still in Mobile County, I think by saying that we've been trying to get supplies, but we can't get them because, you know, medical items that are in short supply are being directed to areas of the U.S. who have the greatest medical need. I have not intended to imply that Mobile County is the only jurisdiction that's having trouble getting test kits. There are lots of areas across the state, across lots of states, that are struggling to you know, identify sources of specimen collection kits, and we are not alone in that. And I didn't mean to imply that someone had you know, was out to get South Alabama or Mobile County and restrict supplies only to us. So we are in the queue. We ask almost every day through our emergency management agency partners and our health department partners when we might be able to get additional supplies. We are expecting to get some additional personal protective equipment this weekend from the state health department, and our EMA partners are going to be working hard on that. And then we continue to request the materials needed for specimen collection and shipping. We did get some additional transport media today, so slowly some supply lines are starting to open up. We're really thrilled about that. But again, just to sort of remind you that medical items that are in short supply are being directed to areas of the U.S. who really have the greatest medical need at this point. So let's see. Imposters. Okay, we talked about this a day or two ago, and I did not say this well, but I will let you know again. So our public information officer sent out a news release earlier today that someone claiming to represent MCHD is about town trying to help us do our jobs. So if someone claiming to represent the health department goes into an establishment, they will have an official employee badge with their photograph on it. Business owners and managers are encouraged to ask for this identification. And any business wishing to verify the authority of someone claiming to represent the Mobile County Health Department, they can call Inspection Services at 251-690-8116 during normal business hours. That's Monday through Friday. I think 8 to 4:30. They may open a little earlier. But again, any business wishing to verify the authority of someone claiming to represent Mobile County Health Department can call our inspection services at 251-690-8116. I've already mentioned that we're having our daily 2:30 calls. So here are some, just want to reemphasize about Wic Appointment. So people needing to get appointments and get clinic-issued formula is happening at the Teen Center at 248 Cox Street, Monday through Friday, 7:30 to 4:30. Please arrive at your scheduled time. Use the front door for outside screening prior to entering the clinic. And then if you have a pickup or a web class due, you can call 251-694-3942. That's EWIC. That's Monday through Friday from 8 a.m. to 4 p.m. So you can get your benefits there so you don't have to come into the clinic. And then if you have any questions, you can call our regular WIC clinic office number at 690-8829. Remember, Vital Records is open by appointment only. Well, looks like here it's going to be open Monday through Friday from 7:30 to 4:30. So, okay, by appointment. Okay, okay, 3 at a time. So we're restricting access to Vital Records to 3 at a time, it sounds like, so that we can maintain that social distancing at 6 feet. So if you need a birth, death, marriage, divorce certificate, you can certainly get that through our Vital Health Department. Also, we have behavioral health services that are now available for anyone who wants to speak to a licensed counselor. This is a very stressful time, and stress and anxiety weakens your immune system, and we want you to stay healthy and mindful. That you can call one of our health counselors at 251-410-MCHD. That's 410-MCHD. So we've gotten a couple of questions that I'll have been submitted online. One is, and we've answered this quite a few times, can COVID-19 be caught over and over again? Or is it more like chickenpox where you catch it once and then you're generally immune? So it is thought that you can only be infected once. We don't know that for 100% sure. We're still collecting a lot of science on that. Certainly, it's likely that you could get infected with one respiratory virus and then become infected with a different one. So we see that quite a bit with flu. But we'll let you know as the science becomes more solid about whether or not reinfection is possible or if you have lifelong immunity. There's a question here about how long does the virus live on surfaces. So it can live on surfaces for up to 3 days. Sunlight is good. Arid temperatures are good. And disinfectant is your friend when it comes to killing the virus or inactivating the virus on surfaces. Here's another question that says, why is it called novel? It is novel because it had never been seen in the world before. So novel is just a fancy word for saying new. So it's just a new virus, something that we had never seen. Is it okay for me to donate blood? So contact the blood centers. They will have the most up-to-date information on screening for blood donation. I'm not aware that there are any restrictions for blood donation at this time, but certainly contact the blood donation centers because we definitely want folks to continue donating if they can. And the last question I have here from some of our online is, are pets at risk? So we've seen one or two situations where pets became what we call seropositive, which meant that it seemed their immune system or their blood seemed to imply that they had been exposed to the virus, but we don't think that pets are a player in this outbreak at this point. So before I take your questions, I'll just mention, so just an hour or two prior to us having this 2:30 press conference, you may have seen one of our local hospitals released that they have identified in their health system 2 patients with coronavirus infection with COVID-19. One of those was in a Baldwin County facility and was for a Baldwin County resident. The Mobile County hospital that released a positive COVID-19 is not in a Mobile County resident. That patient is a resident of another county.
Can you tell us what county that is?
You'll see it at 4.
Do you know what county that is?
I think it's Washington County.
Okay, but you can't say definitively.
I'm pretty sure it's Washington County, but I'll be eating my words when I do this again tomorrow. So yeah, check the alabamapublichealth.gov website at 4, and they will update that. But like I said, we are sure that it's not a Mobile County resident, which is why I had not heard about it until all of you heard about it.
Is that going to happen more often where we have more hospitals down in our area, where we have Conecuh, we have Escambia County, we have Washington County, we have all the other ones just north of us? Will that happen quite more often?
It could happen, and it does happen with other diseases where we have, residents of Mississippi or, across the state line in Florida or Georgia, any of our borders that seek treatment in the neighboring state. And for Mobile, we certainly see that quite a bit. So yes, it could happen where we will have patients diagnosed in Mobile hospitals that are not Mobile County residents. And when a provider tests a patient and they're positive, they're required, as you know, to report that to the state health department. But the state health department only lets us know immediately if it's a resident of our county. So that's why I was a little taken back with that when I first saw it, but then, because I had not heard it. So then it was, explained to me that it wasn't a Mobile County resident.
Given that the positive test happened at Mobile County Hospital, what needs to be done for people that might have been around this person brought into the hospital?
Yeah, so the protocol around the state is the same, no matter where the patient resides. So we contact the patient and do an intense interview with the patient to identify all of the close contacts that person had 2 days prior to first symptom onset. So if fever was your first symptom, then we would say, okay, 2 days before you had a fever, who were you around? Where did you, take your meals? Where did you visit? What appointments have you taken? Those, were you in schools? Were you in grocery stores? We generally use every means possible to help people recall. Like we'll ask them to look at their phone records, ask them to look at their credit card records. If it's someone who drives, like sort of take me through your day. What did you do after you ate breakfast? Who did you eat breakfast with? Then did you go to work? Did you go to the gym? Did you go to church? So go through a very detailed contact or interview with them, and then once we believe we have everyone identified, then public health will start contacting those people to let them know of their potential exposure and ask them to quarantine for 14 days past the date of their exposure and self-observe for symptoms and report to public health if they develop any symptoms so that we can get them in to a healthcare setting so that they can be tested. And that's the same approach that's taken for a case in any county in Alabama or in the U.S. for that matter.
You said you expect to get supplies this weekend, but you've been told things like that before and it didn't happen. Is there any level of confidence that it will be the case this weekend?
We're pretty sure this personal protective equipment is going to get here. We're pretty sure about that. It's supposed to come tomorrow. It might get delayed till Sunday, but we're pretty confident that what has been promised for the personal protective equipment is going to get here. And then when it gets to EMA, it will be sorted and sort of divvied out to our local healthcare coalition partners as needed. And those decisions are being made at the EMA and by Ms. Erin Coker, our emergency preparedness coordinator.
You fully expect it will be enough, or is it you're just taking whatever you can get?
Well, yes, we are taking whatever we can get. It's hard to know what is enough because we don't know how long we're going to be doing this. And so, yes, we're trying not to hoard, but we are happy that the state has been able to fulfill some of our requests of personal protective equipment.
About the Healthcare Coalition, what that is.
Yeah, so many of you may not know, I mentioned the Healthcare Coalition. This is something that has been federally funded for many years in one way or the other. And it's where we have hospitals, nursing home, dialysis center, EMS, fire and rescue, just anyone who touches the healthcare sector is part of a coalition. They meet monthly, they plan together, they decide together how federal assets will be used. So let's say if a hospital believes, some of the federal money that we get for preparedness needs to be spent on moving a generator from the basement to the roof, then the coalition will decide if that is a purchase that best meets the needs of the community. So it's a very collaborative group. They are meeting every day during this outbreak and just talking with each other, sharing information and that sort of thing.
As far as test kits, though,
Sorry.
is that still just up in the air and you have no idea when they will arrive?
Yes. Yes.
Are you being promised anything?
The Mobile County Health Department requests have just been denied so far, except for this transport media that we got today. The swab and the swab collection vials, we have not received any fulfillment of those requests. And again, that's just for the health department. I'm not sure what other hospitals and other healthcare centers are doing or what they have on hand.
For those who don't know.
Sorry, hold on one sec. Okay, transport media. So transport media means you take the swab and then you put it in some liquid that stabilizes the virus and preserves it while it's in shipment to the lab.
You say that testing supplies are limited, going off that question, and it's been naive to think that there aren't cases here in Mobile County. Is it fair that your guys' request for the Mobile County Health Department is being denied so it can go to other places that may just have as many cases as here? Is that fair?
That's kind of a loaded question. So yeah,
Because a lot of people want testing. That's
I
what
know,
we see
yeah,
on social media.
yeah.
A lot of people saying that they want to get tested, they can't find a place to get tested.
Right.
Supplies are being declined for you guys, the test kits, to go to other places. Obviously, Birmingham has more people
So,
there.
yeah, and the hospitals are more higher priority than we are, right? I mean, we really are trying to make sure that our hospitals have all the protective equipment and all the testing material that they need so that they know what's going on in their hospital and they can protect their services and they can protect their staffs. So if I had 100 kits and a hospital had none, I would personally drive my kids over to the hospital because they are the ones that need to stay open so that the most critically ill can get the care that they need. So it's not that nobody in Mobile is getting testing, it's just that, there are, when we have things that are in short supply like this, we have to make decisions about who are the highest priority customers and where are the highest priority facilities and make them sort of first on the list, and that's what we're trying to do.
You said the kid has been fever-free for 2 days. When was he tested?
So I don't have my,
When was this person tested?
so I don't have my notes in front of me. From what I remember, it was on the 18th. Today's the 20th, right?
Yeah, he was. So
Tested on the 18th, and we were notified then of the positive test the next day.
So it didn't take long for that test to come back?
It did not.
And so clearly it was a pretty mild illness. If he doesn't have a fever at this point, would that be probably indicating?
Right, right,
Okay.
yes.
How long does it take for someone to come in for a test and get the results back? I talked to one lady who claimed she was at Spring Hill and it's 3 days now.
Yeah, it depends on what laboratory it goes to. So there are some high throughput laboratories that are able to, if they have the specimen in their hands, they can run a test and have a result in a few hours. I've heard 4 hours. That's a high throughput test. And that's if you have it when you have it in your hand. For the test that's being done at the state laboratory, I've heard between 24 and 36 hours from the time that they get the test. But again, the specimen has to be pulled. If it's going to Montgomery, it has to be shipped or couriered, and then it goes into the queue, and maybe they probably are not testing they probably batch them, right? Like we'll test every 2 hours, put a batch on the machine or whatever. So it depends on where it's being tested and how far the specimen has to be moved and that sort of thing.
The specimen was pulled for that child in Mobile County at a pediatrician's office. Do you know where it was tested? Was it a private lab or was it up in Montgomery?
I don't know. I don't know. Yeah.
We're expecting the testing equipment or materials, temperatures, that's what we're waiting on, right?
We're expecting some protective equipment tomorrow, but that's not going to like solve our problem because we still have testing supplies that are in that are in high demand and short supply. So these are the swabs, the tubes, the shipping media that we need to collect the specimen from. It's a nasal swab, a nasopharyngeal swab that we're kind of in short supply.
We're expecting high temperatures this week. There was a question from a viewer, like 80 degrees next week. Does that have any effect on this? You mentioned at one point that the heat kind of can inactivate the
Yeah.
virus. Is that a good thing that it's getting hot? Is this going to help us? Does it matter? Does humidity matter?
Yeah, I hope it does, but there's no science to show that it will because this is a novel coronavirus that we've not seen before, so we've not gone a full season with it yet. I mean, the way seasonal influenza works is that it generally picks up after, in the fall and then fizzles out in late spring. It would be great if the novel coronavirus did the same thing, but I don't know what's going to happen. A few years ago, 10 years ago when we had pandemic influenza in 2009, that virus really started in the spring and summer and was active all summer long. So it's just going to take us some time before we know how this one's going to behave.
People are seeing only one confirmed case in Mobile County. Should people let their guard down? I mean, you've been saying for days, naive to think that there are not cases here. And the fact that
Right.
24 hours later, there's still only one case.
Right. No, I think that we suspected it was here. Now we know it is. We still don't know to what extent. And so, and we may not know that for some time. So absolutely continue to adhere to those public health measures that we've been saying about staying at home if you're sick. You may have heard the president say today, if you have someone in your family who's sick with a fever or cough, his recommendation is the whole entire family, the entire household stay at home, just to, be extra cautious. And so if you're sick, stay at home. If you can, tolerate a mild illness at home by hydration and over-the-counter meds, certainly we want you to do that until you're fever-free for 3 days. And remember, those groups that are at highest risk for severe complications or death, people who have underlying medical conditions, immunosuppression, diabetes, obesity, those sorts of things, or if you're 65 and older, and particularly if you're 85 and older, we want you to isolate or to quarantine yourself and stay at home to the extent possible. Today is my grandmother's 90th birthday, so happy birthday, grandmother. And they're not able to go out because the whole family's there except me, and they're not able to go out and celebrate because of her age. It's just not worth the risk of getting her out of the house.
One last question on test kits. Are COVID-19 test kits any different than maybe other influenza testing?
Yes.
It's got to be something specific. Could you explain that?
Yes, so the question is about the difference between what we currently have for coronavirus and other test kits. What we have for strep throat and flu are what we call point of care tests. So those are tests, sort of like a pregnancy test that you can do, bedside, whether it's, a swab or a urine specimen, things that can be done at the point of care and you get a result right away. But that's not what we currently have for coronavirus. Again, it's taken some time. We didn't have a rapid flu test for a really long time, and it's still not a great rapid test, but we have it. And so it will take months before we may be able to have a point of care rapid test for the novel coronavirus. The way it currently works is you have to take a swab, extract the genomic material from that swab, and then run advanced molecular diagnostics to get the test result on that genomic material. So you're looking for that genomic material being present in the material from that swab. Other questions? Yes, sir?
Folks last night on the news saw, stadium and the grounds, that was ordered by the mayor. What's the health department's role in all that? Can we expect any activity this weekend at those facilities, and what can you tell us?
Yeah, so the question was, we've heard, sorry, is that my phone? We heard out of the mayor's office that he's hoping to set up 2 drive-through testing facilities. Our health officer has reached out to the mayor to offer assistance and advice, that sort of thing. Dr. Eishold and our emergency preparedness coordinator, Aaron Coker, went by Ladd Stadium this morning to check out one of the locations and to provide, just to take a look and see what they were doing and have some conversations about maybe some best practices, that sort of thing. So if the mayor is able to get the materials for taking specimens and sending them off for testing, then we are excited about that, and we'll provide as much or assistance as we can.
You mentioned that the process of identifying the people who came in contact with that child, do you know how many people that was? Was it at daycares? Was it schools? Was it teachers? Was it fellow students? Is it a huge population? Is it a small population? Can you give us any insight there?
Yeah, so in this situation, we were really lucky in that it is a small number of people. So because of some of the community mitigation efforts that had already begun, we're very lucky that we did not have schools exposed during this event. We had very few locations that were involved or potentially exposed by this person, and those folks have already been contacted, and they are complying with public health requests to quarantine and to monitor for 14 days. So we're really very fortunate in this situation that because some of the mitigation measures that had already been initiated in Mobile County, we were pretty lucky in this situation that we didn't have a whole lot of people.
Single digits, double digits, hundreds?
It's probably double digits, but I think no more than probably 10 or 15.
And do you know how this kid was exposed?
No, I don't. I'm glad that you asked that question because I know people will be curious. I'm really curious. But I've been checking with our nurse investigator who's been chatting with the family, and I don't have the answer to that question.
New York Times ran a story today about a guy who got, it's in intensive care, I believe, in New Orleans. And I'm trying to pinpoint where he might have been exposed at, and his wife's only comment was, well, we were at a Mardi Gras parade.
Yeah, that's too bad. So let me just give you some statistics from the CDC. This will just give you an idea. So CDC yesterday, as of 10:30, reported that there were 10,442 cases of COVID-19 detected in all 50 states. So that's 10,442. They knew that 310 occurred through close contact with another case. 290 occurred in persons who traveled internationally, and 9,842 cases are still under investigation to determine the source of exposure.
So is it community related probably for this
It
kid?
could be, but it just speaks to how difficult it is to identify the route of exposure once you begin having community spread.
Well, in this case, if it probably was, assuming it may have been community exposure here, clearly the person who may have exposed him, or the
Right.
person, had very minor symptoms and didn't think anything of it.
Yeah,
What
or
do people know
yeah.
about it? Stay home? What?
Yeah. So right now, as you probably saw the president say that he's not planning to shut down the nation. There are some areas, jurisdiction. We heard a couple days ago that San Francisco Bay Area was being asked to shelter in place for 3 weeks. Areas of New York are now being told to stay home for a certain amount of time. So you're right. This child had to have been exposed by someone somewhere out in the community. So again, we're not ready to tell everybody to stay home. It's just not that time yet. But again, if you monitor your temperature, if you have a cough, if you have a fever, please stay at home and don't circulate about the community.
I'm not sure if there are any more questions, but what's your biggest concern right now as we stand with Mobile Infirmary having another case, not
Yeah.
in Mobile, another county, obviously, that's being
Right.
What's your biggest concern as an epidemiologist with Mobile County Health Department?
Yeah, I think, for my staff, more cases means a lot more work, and we will do it and we will get it done. We have surge capacity to follow all of our cases, but it's going to be a long haul, and everyone's working around the clock to try to try to curb the outbreak and curb the transmission. But that concerns me just as a supervisor of disease intervention specialists and investigators and that sort of thing, because we're all already beginning to get fatigued. But from a community health perspective, I am concerned about the focus on the lack of test kits and maybe the complacency with adhering to the recommendations to isolate and quarantine and stay at home regardless of whether or not you have a test.
Do you want to say definitively that test kits don't matter?
No, absolutely not. Test kits matter because we need to understand the epidemiology of this virus. If we could do sort of just random testing of, 5% of the Mobile County population and collect that data and know where it is and who it's affecting and who's getting severely, that would be great. But we don't have that right now, and so right now we really need to be focusing on keeping our hospitals open and functioning and try to keep, the illness, to try to slow the transmission to such a degree that we give our hospitals the chance that they need to keep, critically ill patients healthy and alive.
Is there any idea on how many people have been tested so far?
No.
So you're saying test kits obviously have an importance. If
Yes.
the person's very minor ill, do they need a test kit?
No.
Tested?
No,
So if the
they don't.
serious ones are the ones you guys would like to see tested.
I think that, so, for example, if we had a nursing home if we had a patient in a nursing home, we would need to be in there testing a lot of people, right? Because that's a very confined space, and they could very easily, have lots of cases in there. So it's not just sort of a, do you test this person or not? We're just trying, again, just to conserve for those critically, for the hospitals and care facilities that are taking care of those that are most critically ill at this point.
You've seen the models, I would imagine, as far as infections here in this country.
Yeah.
Does it leave you pessimistic?
I really don't. I mean, I'm a scientist, and so I know it's based on science, but there are so many assumptions that I try not, that goes into modeling, that I try to not to look at like one line. I'd like to see what the model lower end and upper end is, because that gives me some context. Like, it could be as bad as this, but it might not be so bad. So I generally don't worry too much about what the models are saying. But it does sometimes give folks kind of a rude awakening that it could get pretty bad really fast if we don't heed the instructions that we're getting from our public health authorities.
You mentioned complacency earlier. I've seen some images in other parts of the country, just an example of a pharmacy with 6 feet distances where people are supposed to stand in line in order to go to the checkout. You drive by Lowe's or any big box retailer, really, you see full parking lots around here. Does there need to be enough communication, I guess, still with some of our retailers to let them know we need that safe distance?
Yeah, I think it's not just retailers, it's everyone. I mean, there are, 10 of us standing in this room, and we're all within about 20 feet of radius of each other. So it has to be, it's a new normal for us, right? Like, we're not used to, bumping elbows and maintaining a 6-foot distance, and so it's just new for everyone, and we're all gonna have to sort of chip in together to try to remind one another that this is the real thing, y'all. This is the real deal. I mean, we're having the worst pandemic since the 1918 Spanish flu. So luckily, the illness itself, and 90% of the people, is not going to be a severe illness. It's going to be mild. For those 10% or 5 to 20% that may get severe complications, or we need to protect those folks. So those of us that are young and healthy have a responsibility to try to protect our older populations and our folks that are medically fragile by practicing that distancing, even if we don't need it for ourselves.
Nobody told people what to go
Yeah, so,
Get
you,
everything off the shelves right now at stores.
yeah, we've got a do 10 to prepare. Alabama Department of Public Health and Mobile County have this do 10 guideline, and I don't know what all 10 they, what, pick 10? Get 10, get 10. So you need things like canned food, medication. James is going to help me here. Cleaning supplies in this situation, so you need maybe disinfectants. Sometimes, you know, water supplies, so we really are trying to discourage the use of plastic bottled water, but maybe, you know, in gallons or something of that, of that nature. Batteries, I said at some point I generally keep a little cash on hand, that sort of thing, so Mark's going to help me with the Get 10. Food, water, you know, a can opener, if you most people don't even have hand can openers anymore, so you need a manual can opener, medications, first aid. Again, some of those over-the-counter medications, make sure you have aspirin, ibuprofen, cough suppressant, hydration supplies, so particularly if you have children, might be time to buy some Pediapop. That's me, that's not on the list. A flashlight, radio, clothes, personal care items, and important documents. So this is sort of basic emergency and disaster preparedness supplies, but this is a really good list. But I would add to this, like I said, disinfectants, maybe household gloves, so that if you do have a sick family member and you're having to clean their bathroom or clean, that you can, you know, wear some gloves while you're, you know, cleaning their spaces, that sort of thing. Soap. It's crazy because like hand sanitizer is, you can't find it on the shelf, but there'll be, you know, racks of soap. Like soap and water is a great hand sanitizer, and so it doesn't even have to be bar soap. It can be laundry soap, or, you know, clothes, dishwasher soap, or clothes washing soap. So those kinds of things, I think, in this situation would be important. I'm not sure what started the run on toilet paper. Okay, any last questions? So we will not be doing Facebook Live 2:30 update over the weekend, and we'll talk to our colleagues here. We are committed to doing it at 2:30 if people think that it's important or valuable or you find it useful. So stay tuned. Sorry, Tyler's got one more question.
I'm so sorry, Dr. McCray.
That's okay.
So you guys aren't doing a briefing over the weekend, but Monday, what's your expectation? Are we going to have more cases, you think?
Yes, probably. It will not surprise me. So maybe we should plan to go on Monday, just so that we can cap up what happened over the weekend. Okay, thank you all.